Despite advances in ethics and practice, race and socioeconomic status are still major determinants of health outcomes in American medicine. We invited pediatric patient families from Cincinnati, Ohio, to share their perspectives on race and medicine on the subject of acute pain care and perioperative and postoperative experiences. My name is Dylan Atkinson. I'm a medical student from Ohio University, a student researcher at Cincinnati Children's as well. Our study is focused on the qualitative aspect of a mixed methods qualitative-quantitative study, where we held focus group meetings for pediatric patients. Pain is identified as a leading cause of disability from studies on the global burden of disease. Current literature suggests that disparities in pain management occur across a wide variety of patient scenarios, impacting both adult and pediatric patients. And more importantly, these differences have been found in the uses of pain medication, specifically opioids and other analgesia when indicated. We aim to get a more empathic understanding of pediatric pain experiences, and by doing so, we invited non-Hispanic white and non-Hispanic Black families to participate in these focus group meetings we held using Zoom. We recruited children aged 8 to 17 years old with a past surgical history within 2 years. After recruitment and consent, we assigned each pair being child and their primary caregiver, to the respective cohorts, where we conducted interviews using a focused, standardized script. Our script is focused on 5 core domains: 1, satisfaction with pain management; 2, pain assessment, tools and strategies by providers; 3, sociocultural beliefs regarding pain medications; 4, pain coping styles; and 5, barriers to care and barriers to access of healthcare. And this is all summarized in the table below in the section of methods. We found that although our pediatric cohort was younger for our African American group, the 2 pediatric cohorts were otherwise similar in sex distribution, pain etiology, as well as pain management. Responses from our adult caregivers generated the majority of thematic subjective data. Feedback from our pediatric participants gave us a lot of significant data as well. However, we also found that their responses often varied depending on the age of the child. In certain scenarios, such as questions about pain medicine that could be easily confused, we often had to redirect younger children more and get help from their parents. Several pain coping themes, such as stoicism, were shared between both of our cohorts. Other themes and other types of sociocultural ideology, however, differed between the 2 groups, and this highlights the need for future study on this study that we did, which is an example of a pilot study of its type. We generated coding frequency based off of thematic analysis that we did of positive and negative sentiments that were endorsed by our caregivers as well as the children. And this is demonstrated in results continued. A major theme that we found that goes beyond this graph is that between our coding frequencies and also direct quote analysis and further thematic analysis, we found that trust was a very major factor that was underlying a number of responses. We found that between the African American and our white group, the level of trust varied significantly. We found that African American caregivers, being the parents, often felt that trust was something that was more tentative and that it was something that stood to be earned or could be lost with a bad experience. I choose this quote from a caregiver: "It depends on how they make me feel. I can judge every doctor for it. I don't put my trust in anybody that way." This was not consistent with our other cohort, the control group, where the level of trust was very consistent. It didn't stand to be gained or lost. Overall, Black and white cohorts both expressed consistent satisfaction with pain. However, we found that barriers related to provider trust, internalized discrimination, and lack of understanding were higher among our African American group. Positive sentiments of a whole were more frequently endorsed by a white cohort, and thematic analysis of anxiety and other subjects was provided mixed results, which highlights the need for future study on this subject.